Hello, my name is Marvin Hernandez, and my pathology project is on concussion. Today I'll be talking about the description of my pathology, which is concussion, the symptoms, the limitations and restrictions to test, terminology, healthcare setting and team, interventions, goals, evidence-based practices, followed by a pop quiz. A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. Another definition of concussion is the complex pathophysiology process affecting the brain induced by traumatic biomechanical forces, by Patience, 2020. Some of the symptoms of a concussion are loss of consciousness, visual and speech impairment, headache, head pressure, nausea, dizzy, blurred vision, loss of balance and control, generalized weakness, ringing in the ears, sleep issues, sensitivity to light and loud noises. Other symptoms, such as emotional and cognitive symptoms, would be problems with concentration and memory, cognitive impairment, and behavioral or personality changes. Emotional symptoms may include irritability, sadness, or nervousness. Some of the limitations and restrictions of having concussions are no excessive activity such as walking or moving. Participation restrictions include no athletic activities such as sport or leisure, and no excessive exercising. Other limitations include avoiding activities that increase heart rate, nothing require high mental concentration, and no caffeine. Other tests to diagnostic tests for concussions would be a CT head and neck scan, an MRI. Neurological tests include neurochecks every 2 hours for the first 24 hours and every 4 hours after that. Other tests include posture stability tests, balance test, and we'll get into more of that later. Some of the terminology. Some of the terminology include a mild traumatic brain injury, chronic traumatic encephalopathy, concussions, and cephalgia, which is a headache. Healthcare settings and teams. Patients with concussions may be seen in urgent care facilities, inpatient hospital, emergency department, neurology floor, ICU, trauma unit, and in post-acute care settings such as acute rehabilitation unit, outpatient physical therapy clinics with specialties in sport and neurology. The healthcare team include neuropsychologist, neurologist, sports medicine specialists, physicians, nurse practitioners, or specialists in rehabilitation such as PT, OT, and speech therapy. Some of the interventions included would be the gaze stability training, which is when a patient is diagnosed with a concussion, they slowly show symptoms of difficulty tracking. One of the ways PTs can help perform an ocular exercise to tolerate with visuals they saw before the injury. For example, this is an exercise called a pencil push-up, which allows the eyes to maintain focus on an object without moving their head. Neck rehabilitation. Concussions tend to result from trauma in the neck and head, and they are trying to protect themselves. The patient's neck will become tense. One of the things PTs can do is help relieve this by performing a deep tissue massage or trying to help improve cervical or thoracic spine mobility. As you can see here are some of the neck exercises a PT may prescribe to a patient. Other interventions include balance rehabilitation, such as using an RX pad. It's common for concussion patients to have symptoms of dizziness even days after the initial injuries. To help patients, PT specialized in vestibular rehabilitation will have a patient perform exercise to help improve balance, corrective differences in the inner ear, and help improve the ability of focus. Here is the study that supports these interventions. So, the patient healthcare outcome and goals are for patients to return to play, return to work, and regular activities of daily living. Pop quiz. Question 1. Determine if the following statement is true or false. Taking medications such as aspirin, ibuprofen, immediately following an injury is contraindicated. The answer is true. Question number 2. What's the best way to manage concussions? Educating coaches, athletes, and parents. Taking a suspected athlete with a concussion out of a sports game. Requiring clearance from a licensed healthcare provider for an athlete to return to play. Or D, all the above. The answer is D. In summary, here are the things that I discussed, which was the discussion of concussions, the symptoms, the limitations and restrictions, tests, terminology, healthcare setting and team, interventions, goals, evidence-based practice, and a pop quiz. Here are my references. Thank you. The end.